Awesome. And where she just recommended that.
Okay, we are live.
This paradigm shift, or just a different way to think about what causes disease. I heard the word you're live now. How many people out in the real world?
I don't think that's really what we're going for. I think the video link is going to be more.
Yeah, recording.
Okay, are you re-recording now?
Yep.
Oh, okay. I thank you all for coming. I really appreciate your time. I'm really honored to be presenting today on CBD. And some of the things that I learned as far as CBD goes, as far as potential use for clinical practice. So I'm a DMP student at the University of Utah. I'll just throw out a shout out for that. As far as this presentation goes, this is part of my DMP project. So in order to understand CBD, we need to talk about the endocannabinoid system. And I apologize to all of you out there. I'm going to look at the camera. Is that okay? You guys okay with that? I really appreciate you all here. So as far as the endocannabinoid system, this was a system discovered about 10 years ago. So in other words, it's relatively new as far as our understanding of what's going on in that system. But it's a lipid-derived signaling system. It's involved in neuromodulation and homeostatic, basically throughout our entire body. We have receptors in the brain and the periphery doing a bunch of different things. Essentially, in this system, we have two receptors. We have CB1 and CB2 receptors. So these are G-coupled protein receptors. They're located presynaptically, and they help control the release of neurotransmitters, both at the inhibitory and excitatory synapses. A little bit more about CB1 receptors. So they're located primarily in the CNS. They're excitatory in nature, and they're responsible for physiological effects on pleasure, memory, thought, concentration, sensory time perceptions, coordinated movement. Essentially what they do. They are located throughout the whole body, but primarily in the CNS. The CB2 receptors are located primarily, again, some in the brain, but primarily in the periphery, specifically the immune and circulatory systems. So they regulate immunologic responses, as well as the anti-inflammatory role and the regulation of cytokines. Endocannabinoids are in our body naturally. The most studies, there are several of them, but the most studied are anandamide and 2-arachidonyl glycerol. We'll, from here on out, call that 2-AG, just to help me out. CB1 and CB2 receptor sites is just a picture version of what we just talked about. CB1 mostly in the brain, and CB2 is the immune system. So this is how it affects our body and some of the symptoms that we're going to target when considering the use of CBD. So cannabidiol comes from marijuana. We need to talk about that real briefly. So marijuana contains over 100 cannabinoids, THC being the primary and most psychoactive component in marijuana. And CBD is considered the non-psychoactive component of marijuana. The mechanism of action is primarily to mitigate the effects of THC. So this is actually really important as far as understanding what CBD does in its role. Just an interesting side note. So when they discovered this, the marijuana growers actually recognized that CBD took away some of the euphoria of THC. So they started removing that CBD from marijuana. So in naturally occurring cannabis, you have a maximum THC concentration of 10 to 15%. But medical marijuana dispensary websites suggest concentrations as high as 33%. The only way that you can have that happen is by removing the CBD. So we've got these phytocannabinoids, THC and CBD. Now, THC works as a partial agonist at both CB1 and CB2 receptors. So their psychoactive property is likely through the modulation of GABA and glutamate. However, CBD is an inverse agonist at both CB1 and CB2 receptor sites. So what this means is an inverse agonist acts on the same receptor site as an agonist, but it actually causes the exact opposite effect or response of the agonist. It also prevents constitutive activity at the receptor sites, and it simulates, like I said, the opposite response at the receptor site. So this is just to kind of point out the difference between THC and CBD. So you've got one double bond and an addition of a hydrogen molecule, and you've got CBD. However, they act completely different. So there's some potential benefits to CBD. There's a ton of research out there targeting a bunch of different symptoms, but I chose to focus for the purpose of this presentation on anxiety and pain, because we see that a lot, both of those in mental health. So as far as decreased anxiety goes, so that inverse agonist property to the excitatory glutamate is the possible theorized explanation to why CBD is taking down anxiety symptoms in some of the clinical trials. So the use of CBD also shows decreased activity at the anterior cingulate cortex, which is the theorized activity anxiety pathway. So there's studies, we have studies showing decreased activation in the amygdala. This is where negative emotional processing and memory consolidation happens. We can prevent some of that and maybe prevent some anxiety disorders from that. It also modulates overstimulated defense behaviors evoked by the same fight or flight system in panic disorder, also found in the amygdala. Just as a brief side note, because this has nothing to do with the endocannabinoid system, but anti-anxiety effects of CBD may also be attributed to its agonist effect at 5-HT1A. So as far as a decreased pain, obviously we understand the correlation between physical chronic pain and mental illness. So this will be important for a bunch of our patients. So CBD works by the theorized inhibition of cyclooxygenase, which is responsible for prostaglandin synthesis. That's where we feel pain and get the inflammatory response. And also lipoxygenase, which is responsible for the synthesis of leukotrienes that mediate that inflammation. It's also theorized, we're thinking that this is what happens, that CBD enhances that anandamide. That was one of the enzymes in our naturally occurring endocannabinoid system. This is a low efficacy agonist of the CB1 receptor, and we think that it's responsible for what we get when we feel the runner's high. We think that that's responsible for that. So if we can increase that, we can increase moods, elevate moods, and decrease pain through decreased nociceptor activity. So CBD agonist activity at CB2 receptors appears to be the mechanism for the anti-inflammatory properties of both the primary and secondary pain pathways involved in chronic pain. And then again, also involved in the regulation of nociceptors to decrease that so that we're not experiencing so much. CBD risks. Okay, so we'll talk about the potential legal risks on the next slide. There are some, and it's important for us to understand that when we're prescribing or suggesting this supplement to patients, exactly what that is. But as far as clinical practice goes, this is kind of key. CBD lacks support for use in clinical practice from APA, ASAM, NIDA, and AMA. we can and should be taking their position statements into consideration when we are suggesting treatment plans for our patients. So what this means essentially is that CBD lacks regulation in manufacturing and distribution. So a recent study of online CBD products found that only 1/3 had accurate labeling of their concentration levels. So we don't exactly know what we're getting when we're suggesting CBD and when we're buying them from, online or otherwise. But this is also super important for us as prescribers. CBD is a potent inhibitor of CYP3A4 and CYP2D6. So CYP3A4 metabolizes about 25% of all of our drugs. So this means that the use of CBD may increase serum concentrations of a bunch of different medications. Here's some that are pointed out, obviously, the macrolides, calcium channel blockers, benzodiazepines, Viagra, antihistamines, Haldol, and some of the statins. So that's important to consider when we're talking about drug-drug interaction. As far as the CYP2D6, that metabolizes many of our antidepressants. So we're going to see potential increase in serum concentrations of SSRIs, TCAs, antipsychotics, beta blockers, and opioids if we're using CBD in our patients. This is an important one as the therapeutic window is so small that it can increase warfarin levels. So that's an important one to know for any of our patients on that medication. Okay, the big question is it legal? Now, if you Google this, you will find pages and pages of, yes, it is absolutely, I've researched this, I've studied this, it's absolutely legal. I spent a significant amount of time looking through all the laws and talking to content experts who essentially gave me this information. CBD is still considered a Schedule I legal status. That's important for us to understand because Schedule I medications are not typically anything that we would ever prescribe. So while these products are becoming more available, because of the Schedule I status, they are not regulated in manufacturing, packaging, and labeling outside of the clinical trials. So really quickly, you can read through these later, but the APA position, there is no current scientific evidence that marijuana is any way beneficial for the treatment of any psychiatric disorder. Policy and practice surrounding cannabis-derived substances should not be altered until sufficient clinical evidence supports such changes. So as far as our own clinical practice, I think this is important guidelines for us to consider, as well as the DEA position, which says at present, CBD is illegally produced and marketed in the U.S. in violation of 2 federal laws, the Controlled Substances Act and the Federal Food, Drug, and Cosmetic Act. So what about the Farm Bill? I get asked this a lot because there's a lot of confusion around the Farm Bill. This was a piece of legislation that went through in 2013. But what the Farm Bill essentially did was authorize institutions of higher education or state departments of agriculture to grow industrial hemp. Now, by definition, industrial hemp has THC concentrations of less than 0.3%, and that is considered CBD oils. But it authorizes these institutions to grow industrial hemp for research conducted under an agricultural pilot program or other agricultural or academic research. That doesn't mean that we get to get this online. So this is actually super important stuff. DEA also emphasizes again that industrial hemp is still considered a Schedule I controlled substance, despite anything that you Google. And this is kind of interesting because there have been warning letters to CBD vendors recently, and conveniently right before my presentation, we had a situation locally where a shop in Midway, Utah, actually had some CBD seized from their shop, saying that it was illegal. DAPA came in and took their CBD and wrote them up for illegal distribution of a controlled substance. That was on December 27th of 2017, so that just barely happened. So in 2015, 16, 17, so the FDA is sending out these warning letters, they're calling them, saying stop it. It's in violation of this Federal Food, Drug, and Cosmetic Act. So CBD is excluded from the dietary supplement definition. So you'll hear this argument a lot, that it's not actually a drug, that it's just a supplement. But because CBD has been authorized for investigation as a new drug and substantial clinical investigations have been instituted, then products containing that substance are outside the definition of a dietary supplement. So if CBD would have been marketed before we started studying it and calling it a new drug investigation, then that would have been part of that exemption, but it's not. There, I threw in some example warning letters so that you can read through what some of the vendors are starting to get, and also this CBD oil from the Utah shop. So as far as bottom line goes on CBD, Utah state laws allow CBD in cases of diagnosed intractable epilepsy, and this has to be done by a neurologist or as part of the study program. So those are the two legal ways to use CBD in Utah. So there was an amendment in 2016 called the Medical Cannabidiol Amendment. It requires two things. It requires a DOPL license for the CBD dispensary and special training for the prescribers, and also the Department of Health medical cannabidiol card for the qualified patient. So there aren't very many of them in the state of Utah. In fact, there are only 119 identified as of October 2017. In other words, there aren't very many people who can legally use and possess CBD in the state of Utah. There is some promise on the horizon. There's the first study in Utah started in 2017 for anxiety, pain, and insomnia. They're studying right now. They have about 250 participants right now, and they're looking to grow. The only problem with the study is that it costs patients about $200 to $300 per month. So if you have anybody who's interested in trying CBD and wants to do it legally, that is one option. And I can get more information on the study if anyone's interested in that. But anyway, that's my quick CBD presentation. And if you have any questions, we can do real quick. If not, come on, Stanton's got a question.
We have one, but if you can do it great as well. So I heard in some places, specifically halfway houses, they're spraying CBD oil on cigarettes and smoking them. Is there any, like, are they getting anything out of that? Or is it just more like, people who are in recovery or sort of slightly in recovery, trying new ways to get out?
Right. So probably exactly that.
Yeah.
Remember that it's an inverse agonist, so it'll actually mitigate any effects of the THC that people actually want, specifically in that population, including euphoria. So I wouldn't expect that, although there are CBD oils that have higher concentrations of THC that you can get, that, maybe they're thinking that that's going to make a difference.
I mean, it's not surprising because we know that, it can be anything, and they'll try to use it sort of illegally, so.
Yeah. Well, thank you. Oh, Anne, please.
So what is your rationale for putting this together? Are you arguing for any particular position?
I am 100% neutral on this subject. As far as my DMP project goes, I am not for or against the use of CBD. I'm only presenting the facts that I identified in my research and passing that along to prescribers. So
I really appreciate you figuring out the legal, is it not legal, because you hear so much of that, and there's a lot of misinformation out there about it. Appreciate that part of it. So when you send this electronically to those who have done the pre and post, will you include the link of the study, though, of where they can go, because I always ask my patients about supplements, and I do have patients who are taking CBD on the advice of another practitioner. I have not recommended them myself because of that inconsistency in quality. And I'm nervous about that part of it. But if I had somebody who we couldn't get a handle on anxiety, and they wanted to do this and be able to afford that, I would love to know where to send them to this study.
Absolutely. And as far as my video link goes, it's called ENDO-C. So it's an ENDO /C. And you can sign up through their website. It's through Dr. Stephen Warren is the principal investigator in that study. Okay. All right. Thank you. Appreciate your time. Thank you.